morning, everyone. Thanks for joining us today. I'm Kandyce Tested, CACI's Chief Commercial Officer. I've 30 years experience in data and analytics and a huge passion for what we do at CACI, which is all about ensuring our clients achieve value from our solutions. So I'm chairing the session today. Before I introduce the team, I wanted to let you know we are recording the webinar so we can make the content available for those attending and also for anyone else who registered today but was unable to attend. Please feel free to put questions in the chat. We'll endeavour to answer them at the end, hoping we have time, or follow up after the meeting. And don't forget to put your microphones on silent, apart from if there's questions at the end. We are absolutely delighted to have this partnership opportunity with the NHS England and across all the ICBs, where we're going to be providing a wide range of data and insights to help you understand, prevent and tackle health inequalities. The CACI team today includes Gary Smith, who's the overall relationship manager, Jamie Clark, an account manager, and both those team members act as your day-to-day points of contact and will provide lots of support and answer any queries you will have. We also have Ed Sewell on the call today. His role is to ensure that you quickly get full and ongoing value from our data and solutions we provide, and that we evolve with you as your needs develop. We are due for Ming to speak at the beginning of this session. I'm just going to check, Gary, is she online yet?
Not yet.
No, so we did know she may be slightly late, so we were going to change the running order if that was the case. So instead of her at the beginning of the session, she will be presenting at the end of the session. So we will flip the running order. And I will now therefore pass over to Gary to start. Thank you, Gary.
Thank you, Kandyce, and it's a pleasure to have you all here today across the many teams across the NHS. It's a pleasure to see you all here, and thanks for your time and obviously signing up. So, first of all, a bit of housekeeping. Kandy mentioned earlier, as we go through the presentations, if you have any questions, please put them in the chat. We will be monitoring that throughout and answering at the end of the webinar. As you can see, we have four main sections to cover today. We're firstly going to start introducing CACI and our expertise. Then we're going to move on to what this partnership can support you with, the data behind the partnership, and how you can start to leverage the support that CACI are offering. By the end of this webinar, we want you to be able to identify the different unique data sets, their capabilities, and most importantly, understand how they can be used to tackle different use cases. Ultimately, we want you to identify the first challenge that you would like to tackle off the back of this webinar, which we at CACI will support with. Therefore, as we're going through the slides, if you have a use case that you would like to tackle, then please write it in the chat. This will help inspire your colleagues and also allows us to reach out to you after the webinar to offer personalised support. So who is CACI? We do amazing things with data. Some of you may have heard of us before, and it's probably for our industry-leading datasets, some of which we'll be covering today. These datasets are used across the public sector, wherein we support hundreds of local and central government organisations. But we also support leading private sector organisations such as Spire, Bupa, Roche, and Oxfam. For example, Roche are using our data across Europe to assess and prevent health issues of the future. These organisations effectively use the data to gain actionable insight into their supporters and local communities, ensuring their communications and services are optimised to the correct audience, increasing their engagement. Additionally, the data is critical in forecasting demand and aligning the organisation's needs to its goals. And to show you the power of our collaboration, I wanted to highlight some of the work that NHS Blood and Transplant have completed using CACI data. A recent initiative was set up within NHSBT to tackle sickle cell disease, which is treated through blood transfusions. Typically, the transfusions become less effective over time, but if RO blood is used, then this negative effect is negated, and the transfusions can be used for a much longer period of time. The problem that NHSBT face is that only 2% of the UK population actually have RO blood, whereas 60% of people from Black and Caribbean descent carry the RO blood type. Therefore, they saw a unique opportunity to drastically increase donations from the community. Using a mixture of CACI's data sets and tools, NHSBT were able to tailor their engagement and communication strategy to improve the response and action from the communities they wanted to reach. A hyper-local approach was used to decide where to run media at postcode sector levels alongside other outreach activities and events. Additionally, NHSBT built a new site matrix to highlight which locations would be highest priority to increase RO donations across the country. Using the insight from this work, NHSBT has seen a huge growth of 22% in RO blood donors up and down the country. And new donor centres were opened using this insight in Stratford and Shepherd's Bush. Stratford shooting to the top spot for RO blood donations and Shepherd's Bush landing in the top 5. So overall, a huge, huge success for NHSBT. But what does this partnership mean for you here today? Firstly, and maybe mostly importantly, the data that you see here today is free for all ICBs in England to utilise. But how did this come about? With the transition from CCGs to ICBs, NHS England wanted to bring together the different ICB teams from across the country to ensure that best practice could be shared and similar use cases tackled in an efficient manner. A group of data sets was agreed upon using prior use cases to ensure that the teams up and down the country would be empowered to target population health management. The access to these unique data sets is currently through your partner CSU or Descro. So please reach out to your contact or let myself, Jamie or James know and we will be able to point you in the right direction. All our emails are at the bottom of these slides and we'll be sending these through to you at a later date. It's important to note that we also work alongside many different local authorities, so you will have opportunities to collaborate therein. If you have any questions about who CACI already partner with, then again, please let myself or Jamie know. CACI are here to support each and every one of you and your teams, and we plan to do this in a variety of ways. Kicking off the support with the webinar that you're a part of today. As we move forward, we are looking for volunteers amongst you who would be happy to report back on the use cases you've tackled with our data so that ICBs can learn and replicate from your experience. We'll be replicating these webinars and focusing on those use cases in those sessions. This will continue to promote best practice amongst the teams here today, and CACI are here to support you along that entire journey. Now we've outlined the roadmap, I want to highlight some key examples of how our work can support the team. Improving population health management and tackling health inequalities are key for all ICBs. Our data ensures that the many different health services offered to the UK public are being utilised by all those that require the service. For example, South Yorkshire ICB want to ensure that day-to-day operations are as efficient as possible. Therefore, being able to profile the do not attends and frequent flyers to A&E and then amending the engagement strategies is vital for reducing the impact that they have on both those services. The data sets also open up the opportunity to measure the impact of non-medical factors within a community. West Yorkshire ICB, for example, have a town where every mile you move further away, the life expectancy drops by a year. Medical factors can't explain this, and therefore understanding the behaviours, attitudes and lifestyles of those in the area can start to paint a picture of why that might be. Having spoken to Norfolk and Waveney ICB. Sorry, just a little bit of sound there. Having spoken to Norfolk and Waveney ICB, prioritising emergency responses has also come out as being a priority. Being able to understand the channel and communication preferences of those affected by a flood gives you the opportunity to allocate the correct response. Some people might be happy with a text message or a phone call to support them, whereas others may need boots on the ground to support them, and this ensures that no one is missed. Finally, targeted smoking cessation and other preventative services is vital across the country. And by using our data, you can identify those that may be at risk before they even start smoking. As mentioned, tackling health inequalities is a massive challenge, and initiatives from the NHS, such as the Core 20+5, are vital. CACI can offer support across the many different highlighted areas, as you can see on the screen, but I'm now going to pass over to Ed, who will talk about the research that CACI have carried out into the UK's mental wellbeing. Over to you, Ed.
Thanks, Gary, and morning, everybody. Great to be here. I think it's taking a step back. One of the things that hopefully we've displayed so far is the richness and the opportunity that our data has to support you. There are multiple use cases, as Gary's just taken you through, and we're going to talk about a few more of those as we go through the next few slides. A lot of our work is helping you understand the demographics, the lifestyles, the life stays, the needs of people across the UK. And we've got some great data products that we're going to go into more detail across that help to explain that. One of the great, I think, privileges of the role that I do and the work that we do at CACI is that we have a fantastic opportunity to go deeper than that, to really start to understand the deeper insights that affect our client organisations. And by that, I'm thinking about the external factors that can have an influence and put pressure on the work that you've got to do. The macroeconomic factors, and whether that's the cost of living or the inflation or other factors that all put pressure on the lives that we lead and can change the way in which consumers and we as people across the UK start to behave. When COVID-19 first hit, as an organisation, we quickly recognised that this was not only incredibly difficult time for all of us, and lots of pressures and really kind of life-changing factors were going to take place. We recognised that as an organisation that's incredibly rich with data, we had a fantastic opportunity to help our clients navigate their way through this crisis. And a lot of that was about making our data available. So quite quickly, some of you may have even taken advantage of it. We did make a lot of our data products freely available to public sector organisations because we knew this was a time when commercial challenges need to be put to one side. It was about doing the right thing for the country. But on top of that, we also recognised that we could start to gather information and make that available to help organisations understand more deeply the challenges they were facing, the opportunities that might be out there, and how those factors that I've just mentioned were going to start to influence and change consumer behaviour. So right at the start of 2020, we initiated an ongoing piece of research, a nationally representative study across the whole of the UK, asking consumers what they felt, what their concerns were, and how they were feeling. Because we realised that we would be able to translate that into insight that we could make available to clients such as yourselves. This tracker has continued over time, and having started it through COVID, we've evolved it through the cost of living crisis, and we now have a quarterly Voice of the Nation survey that we produce, where we poll the entire UK population in a representative sample, and we capture the insights that you can see on the screen here. Now, coming back to the point that Gary just highlighted, personal well-being and mental health are incredibly important to you guys quite clearly. What we've seen over time is that has been a significant concern for people across the UK. Across the whole of the sample, and I'll go into some more detail in a moment, we can see that personal well-being and mental health both poll around 50% in terms of people who are significantly concerned about that. And that's as high as it's ever been throughout the polling that we've been doing over the past years. And I'm sure that those of you that go out and look at the media and are aware of this stuff as part of your roles, you'll know that those concerns are increasing. There is continuing concern that those pressures are going to have a big impact on people's behaviours moving forward. Go on to the next slide, Gary. What we're also able to do within our organisation, start to make sense of that. What does that actually mean? How are different communities and different groups of consumers behaving differently? And one of the things I think that's really interesting is that a lot of us go into looking at data and trying to understand what it means with assumptions. And there has traditionally been an assumption that younger people are a little bit more carefree, a little bit less exposed to the concerns of the world, and potentially able to kind of do what they're supposed to do, go out and enjoy themselves and live their lives. What we're able to see, and if we look specifically at the millennials group in this study, that isn't really the case now, which is a real shame for those people, and something that I think particularly us as an insight organisation and you at the NHS, it's really important that we're aware of that and think about what it means. In the commercial world, the millennial group, people that are young, in their first jobs, early career professionals, people that have got relatively high levels of disposable income, have traditionally been a real target group. And lots of our clients in the fashion sector, the leisure sector, the travel sector will traditionally hit that group quite hard to try and encourage them to come and become customers. But financial pressures have hit that group hard. And you'll see here that it's also filtering through to their personal lives. So 64% of millennials saying they have significant concerns about their personal well-being, and a similar number on that on mental health. And that gives us two indications that, first of all, there will be a health impact on their group, but actually there's an opportunity for us to understand more about that and deliver greater insight. In the coming slides, if we go on one more slide, Gary, in the coming slides, Jamie's going to introduce and talk to you a little bit more about our Acorn product. I won't say too much about it now, but essentially it's a geodemographic product that at a postcode level classifies every postcode in the UK into groups based on factors like income and life stage. And again, the sort of research we're doing here is drawing out some really interesting insights that go against what we may have assumed in previous lives before the recent challenges of COVID and cost of living came through. A key insight I think that's interesting here is looking at that luxury lifestyles group. That is our most affluent population across the UK, a group that traditionally live pretty great, good lifestyles, have good levels of income, and one would assume typically shielded from some of the pressures of modern living. But as we can see here, 50% of them are saying they have significant concerns about their personal well-being. So although that is slightly lower than the other red blocks you can see on that slide, it's still quite a significant group. And it's an insight about the way in which they may require services to be tailored from the NHS that traditionally we might not have expected from them. At the other end of it, unfortunately, if we look at the low income living group, we can see they have significant concerns in terms of their personal well-being and their mental health. I'm going to hand over to Jamie now to talk a little bit more about ACORN and the way in which that data can start to be translated. But a part of our role is to deliver that insight, challenge the old assumptions, and help you use the data more effectively moving forward. That research is going to continue. We'd love to talk more about it at a future time.
Thanks, Ed. I'm just going to interrupt here because I know Ming has to drop off at past, and it'd be great to hear from yourself this morning, Ming, before Jamie goes through the products. Thank you.
Am I on? Thanks so much. I'm really sorry I missed the beginning. I've just had to sort out some things in exec. Great to be here. We've been using the ACORN data and the CACI data for a while, and I think it's really important that it's pivotal to everything that we're trying to do to understand the demographics and also the population. So it's one of the planks of population health that you'll all be aware of. So I think we've invested in this tooling the data for you as ICBs, really to enable you to do proper detailed population health. It's really important that you make the most of this data. I think later on we'll let you know how you can get access to it. But I'm a big fan. I think it really helps us, particularly when we used it during COVID, to look at vaccinations, how to target, etc., and where people were, from a demographics perspective, it really helped target. And I think population health is really now making sure that you understand, not just understand your population, but the wider determinants of health, and therefore how that data can then support thinking through what the strategies are, how you can then really target parts of your population for interventions, and making sure that your interventions are hitting the right areas. So I know that when we've used it nationally, it's really given us a breadth and a depth of information that's not available just through our normal data sources. Augmenting this data with some other analysis that you're doing helps you create more robust views of population. I think Jim Lockyer is our link from an NHS England perspective, but do come back to us if you've got any questions at the end of this of how you can access it. Thanks so much, guys. I'm going to drop off now, Kim. Yeah.
Thanks so much for attending today. I really appreciate you providing that overview. Thank you. Great.
Okay, thank
Jamie,
you. Bye-bye.
Back to you to talk about the data that everybody has access to.
Appreciate that. Thank you, Candy and Ming. So yes, as stated, I'm going to go through the data sets on the screen. We've got 4 that are in the partnership. So we have our ACORN family data sets. These are our ACORN household, our wellbeing. These are our flagship data sets within the public sector, and they provide a wealth of information that just go beyond demographics. You can then start to understand the essences of neighborhoods. You can paint that socioeconomic tapestry. You can understand people's shopping behaviors, their habits, and ACORN helps paint those vivid pictures of who these people are and what drives them. We can start to unravel attitudes, behaviors, lifestyles, and the health and the well-beings of certain communities. Picture being able to tailor your comms and engagement, speaking directly to the hearts and the minds of your audiences, whether that's crafting a campaign that resonates with specific groups of people, or analysing the demand for certain services. These data sets are now empowering you to make those decisions that matter. We also have the Ocean data sets on the screen here, and these provide a variety of lifestyle and behavioural data to help delve into the depths of a variety of attributes, looking at occupations, their interests, and other attributes across the communities. We then, it'd be easy if I kind of bring this data set to life. I live at home with my parents just outside of London. I am 25, hoping to move out shortly, but I am classified in ACORN as a family in a leafy suburb. So I'm a classic example of young families, or young adults, sorry, living at home with parents. Whereas if I pick on Gary on the call, he's moved out of his parents a while ago. He lives in the centre of London on a mortgage, so he's classified a little bit differently. So he'll be a young professional in the city. So now we move on to ACORN. So ACORN brings together a variety of rich data sources, segmenting the UK population by postcode into 7 overarching categories, 22 groups, and 64 types. And we can then start to understand that relationship between people and place and the kinds of people that are living in certain communities. We can understand their social factors to behaviours, and it really helps public sectors and especially the ICBs to better understand these people, better target services, and provide, for example, a more efficient healthcare delivery system. With Acorn, every detail tells a story, and with each insight gleaned, we can then step closer to where services are not just accessible, but tailored towards the unique needs of every neighbourhood. And to go alongside the Acorn datasets, we have a variety of supporting materials, one of them being the Acorn knowledge sheet. So this has over 800 variables. A few are shown on screen, so we can start to look at incomes, affluence, occupation, even environmental behaviours. So it even will tell you the likelihoods of people leaving the tap on when they're brushing your teeth. But with this tool, public sector organisations and the ICBs, you can start to fine-tune your understandings of your target audience, whether that's the social drivers of the population or how organisations can then best reach out to certain cohorts of people. With each category, group and type, you also have access to a wealth of pen portraits to uncover top-level overviews for your analysis based on the core demographics, the financial situations, the brands, and the people they align with. And the idea of these supporting materials is bringing that data to life, understanding the unique differences. We have semi-rural maturities on the screen compared to the hard-up households, so you can then start to see any differences or any trends between key audiences. And you can also feed this into visual mapping as well. This is a perfect example of a top-level overview of England, and then you can understand those trends, those patterns. This is a clear example of the different people that live right across England, where there might be pockets of deprivation, where you might need to then prioritise your services to the low-income living in a certain area and the more rural, more affluent people across England. We can then start to drill down into key regions and key communities. This is Cheshire and Merseyside region, and it clearly shows there's unique differences and social factors that make up such a diverse place. And you can then start to understand what services might need to prioritise differently for the communities and the types of people living there. So that's Acorn in a nutshell, and I'm now going to pass over to Ed to discuss the partnership we have with HC1.
Thanks, Jamie. It was really interesting to hear Ming talk about the priorities that you have as an organisation and where she sees the value. And clearly, a huge part of that is going to be understanding the communities, the patients that you serve, understanding the access to services and the needs of those different people. And I think Jamie's given us a really good understanding of how Acorn can support with that. But I just wanted to highlight that actually it has a lot of other there's a lot of flexibility in the services that we offer. And the data that you guys have access to can answer a lot of different use cases. This is a slightly different one. It's for the healthcare business HC1 who provide care homes and care services across the UK. For this piece of work, it was really about identifying and improving business efficiency and effectiveness, helping them become much more effective as an organisation. And coming back to some of the things I talked about earlier with the pressures of external factors, this very much came to the fore about 3 years ago when they were struggling to find staff. Some of us will be aware after factors like the cost of living crisis, the Brexit, and also COVID, there was significant changes in the workplace as people changed their careers, decided to do different things. New entrants to marketplaces came in, and it put a lot of pressure, particularly on the care home sector and their ability to both recruit and retain staff. So they came to us and asked how our data will be able to help them. And if we move on to the next slide, I'll talk a little bit about what we were able to do. So the first thing to say is that our data is incredibly powerful at understanding the types of people. So in the same way that we can profile areas and profile patients and consumers, and you can use that data to understand the people you're talking to, we could do the same thing with their staff. So we took their portfolio of staff across the UK and looked at the people that had applied for jobs, had taken jobs, and crucially had stayed and not left. And we started to identify different audience types. Having done that, we recognised that there were certain profiles of staff, of people who were more likely to be effective recruits, people who would come into the workforce and stay. But we also recognised that there was a significant geographic opportunity to deliver insight to help understand that side of things as well. On the left-hand side, hopefully you can make out the black lines, which are the catchment of a HC1 home, which is the blue dot in the middle of the screen. So we can see the broad makeup of people and the areas that people were likely to travel from. What our analysis was able to do was to identify on the left-hand side, you'll see some orange dots. They're the core profile that make up great areas to recruit from. And the interesting thing there was that we could see that there was a really handy bus route that travelled past the care home. So not only did this make a really great place to go out and start to target and identify a possible opportunity to bring people in, it also meant that the ability for those people to get to work was also supported. At the top right, we did a similar thing. We identified another pot of potential area where we could see a good concentration of likely carers could come from. Unfortunately, the bus route didn't exist, and so we started to understand not only the types of people, but actually how easy was it going to be to bring them into the organisation, get them into work. Additionally to that, there were other factors that had a pressure. So at this particular time, some large recruiters like Amazon and like Aldi, just as examples, were drawing a lot of staff away from care with wages and working benefits and things like that. So they had to think about those factors as well. And all of those were brought into our solution. So we were able to identify how they should recruit, but also where those people were. Having delivered all that work, we were able to give a series of really powerful recommendations to HC1. They were able to use and identify the profile and identify the right sorts of people to go and target. They could use that to target their recruitment activity, putting the right ads in the right places, using out of home, particularly on things like bus routes where they knew they could get people to travel in. But that insight was also incredibly powerful to go out and talk to local authorities, because if they could show, look, we have an opportunity to grow our business, but we're limited by bus routes, they could use that to lobby the local authorities and the bus companies to open up new routes, which they've also successfully managed to do. Happy to speak about that more if it's relevant, but I'll now hand over to Jamie to continue the rest of the presentation.
Lovely. So we also have the wellbeing acorn. So this is our unique health and wellbeing data set, and it is fast becoming one of the most exciting data sets available to you all. You now have the ability to segment the UK population by postcode, like Acorn, but focusing on health and wellbeing attributes of the community, and having access to such granular information. With a few on the bottom here, you can start to look at medical conditions, the likelihood of eating fruit, smoking, alcohol intake, and it will really start to provide you the insights to really tackle health inequalities head on to where they're most prevalent. And you can now start to tailor your services to the people in most need, driving that social change. And again, like Acorn, we can start to map that, and we can start to understand the different communities. So again, we've got this Cheshire Merseyside example. We can, and it will Wellbeing Acorn then start to tell us a different story, looking at the health and wellbeing. So we can then understand the unique health challenges of the communities that we face. In this screenshot here, we can see that we have one community that might not fit the surrounding location. We've got a small community of people that might have health challenges compared to this wider community where they're a lot healthier. So we can then start to think about certain health provisions targeting that certain area. And then going back to what Gary and Ed were talking about with the mental health and the core 20+5, looking at smoking cessations, we can now take elements of Acorn, specific data from it, to understand smoking prevalence across the same region. We can then start to understand communities where there might be higher smoking rates highlighted in those dark reds. And again, with these two examples here, we can see that there is a high likelihood of people living in a community where there's higher smoking prevalence. So again, we can understand these details, understand if there are the right provisions in place to help tackle these challenges, and it helps the ICBs understand what more they can offer to the communities. I have this case study here with Coventry, but the idea for you all to understand is the insights you can drive for comms and engagement strategies, similar to the smoking cessations on the previous screen. So with Coventry City Council, the challenge for them was testing across the community for lateral flow testing, and there was a underrepresented population of people that weren't testing. The council just didn't really know who these people were. So they came to us at CACI, and they started to profile the testers versus the non-testers. And so on the screen here, we can see the underrepresented, the overrepresented demographics who are more likely to test versus less likely, and we're starting to build a picture of who these people are. And the council identified there was a higher number of young adults and kind of teenagers that were less likely to test. And using Acorn and the knowledge sheets that I showed previously, where you can start to drill down into certain variables, they've understood their behaviours, their preferences, how they like to be engaged by the council, and found that YouTube was the best platform. So they ran a campaign on YouTube promoting lateral flow testing. They explained how people get involved. They signposted them to testing centre locations, and the testing centre locations were put in areas where there was a high number of these communities living. And just by engaging in the right way, making this information easily accessible, easy to digest in a platform they like to be spoken to via YouTube, the council saw an increase of about 30% in lateral flow testing. So now I'm going to pass over to Gary to talk through the ocean data sets and the variables.
Thank you very much, Jamie. So yeah, finally, the cherry on the cake is our attribute-rich ocean database, which differs from our other datasets by enhancing the view of your local community. Whereas Acorn Group B is the same in Bristol as in, say, Manchester, Ocean gives you an accurate picture for your local community. For example, how many people in Cheshire are digitally connected? How many people around Birmingham have private medical insurance? With Ocean, you can start to investigate and analyse these factors. So how can you actually take advantage of this partnership and benefit from this yourselves? It brings us back to how we started the day. We've guided you through the different data sets and their capabilities and offered many different use cases that our data is used to tackle, whether that's increasing RO blood donations, targeting recruitment drives, or supporting with healthcare services. CACI data can help. As I mentioned at the beginning of the event, we want to help you tackle your first challenge. Therefore, if you are yet to write a challenge in the chat, please do so now, and we'll be reaching out to you in the coming days to support you on that journey. Have a think about the use cases that we've discussed and the ones that you can see on the screen now. But if there is something that we haven't discussed, please still write it in the chat, and we will reach out to you to offer support if we can tackle that. Now, that brings us to the end of the slide, so I'll hand back to Candy to see if there's been any questions in the chat.
Thanks, Gary. I've answered a few of them. So we've had a question about the data sources. So we use open source data, census data, research data, and other commercially available data sets to build our solutions, and we can provide technical documentation for those who are interested. So that's no problem. We can follow up with that. There's a nice question here. Do we have any case studies with urgent care and those presenting at accident and emergency departments? So Jim, you've responded to this, saying you've undertaken some work in this area before. I think you studied it in Bradford and built out some pen portraits. Do you want to add to that? That'd be quite useful.
I mean, that's a long time ago. is what I would say. So we had sort of identified the core people who potentially we would wish to target to suggest not coming to A&E because they were, they were needed to be diverted to primary care and not secondary care, and they were kind of using the A&E department as a primary care source. And it was answering a specific question at the time. I don't think of any material left, as it's back of the PCT days to give you a sense of when. The other contact in terms of sort of high usage in terms from an NHE point of view would be Rob Shaw, who's on the call as well.
Right.
So yeah.
Yeah, but certainly, profiling those presenting is no problem, and you could get some richer insights from that in tackling that overall. Let me just go to another question. What would you recommend for identifying the demand for emergency trusts? Any particular data variables that are best to consider first? Does anyone want to answer that before I answer it? No, okay, so I would start with using Acorn because you get that good general insight, and it actually has lots and lots of variables underneath it, which will give you that richness, and then you can see which key variables are coming out as key variables. So the data almost does the talking when you do the profiling. We've got an interesting question from Joe here. Ed, do you want to answer that one?
Yeah,
So,
first of all, I think, sorry.
Yeah, sorry,
Yeah,
do you want
go
to
ahead,
just
Kandyce.
to talk about the question? Sorry, we have a challenge to identify location and communities that we cannot engage with using digital channels, limited funds to devote to it. So, Ed, do you want to just follow
Yeah,
up on that?
absolutely. I think that's a really interesting question. It leans a little bit into the case study we showed you for HC1 and the way they were particularly focused on out-of-home media and thinking about that kind of location-based contact. Appreciate the point about the efficiency of this stuff, but also trying to identify the communities. So absolutely, the data can be used to understand not only the types of people, but also their appetites and their exposure and their interest and their ability to respond to different types of media. Some of that data is specifically included in the Acorn data. It's also in the Ocean data as well. So you can profile both of those things. I'd also be very happy to have a separate conversation with you to talk about specifically what you could do to drive a response with the budgets being limited. So we'd be very happy to follow up on that. But the data will absolutely support that use case. We've got a lot of experience in that area as well that we could talk to you further about.
Great, thank you. Jamie Jong for NHS Southwest London. Yes, Acorn does aggregate to a higher level, and we also can provide it LSOA level. So any geography you require, we will make that data available in that geography. So we have postcode sectors, districts, LSAs, etc., MSOAs as well. Thanks for mentioning NHS Blood and Transplant and see how CACI have helped us opening a new donor centre in Brixton in September using the data. Fantastic to hear that. That's absolutely great. Trying to read as quickly as I respond here. We'll take the question from John Adamson. We'll take the question regarding local authorities and NHS offline. Lots of local authorities across the country access the data as well. So it's trying to join up everybody across the country overall. Joe McCrea, can I ask the data director as a trust or do you need to go via the CSU? Yes, it's CSUs and ICBs who have access to the data overall.
No, just intercept there a little bit. So the two things are, I've forgotten one of them now, but with the access to the data at this point, our immediate way to get it out was to do Tedescos and CSUs within that process, because it's coming out from our point of view as potentially clear data or linkable data. That's why we chose the Tedesco route. If you've other options, we're creating a mechanism via Azure SAS tokens and things like that to be able to link to the data directly. So yeah, it's just questions for that one. For the main release, just reach out to myself on it. And I think on the contractual stuff, there's quite a few ones to cover off, most of which we have discussed at various points, so we do have answers for them.
Yeah, so I'll leave you to discuss things like charging, internal things overall. Jim, you can pick those up offline overall. So what's the name of the data set if you want to ask for access? Acorn, CACI Data Solutions, I think is probably the easiest things. Again, channel your questions to Jim overall. Is there a difference between having a direct license with CACI or versions from the CSU? No, you will get all the content and all the support required overall, so that doesn't differ. Assurance on coverage or this is moving as I'm trying to speak. What percentage assurance or coverage do you use in your litera? Let me just read the question. This data gives assurance that cohort leave their taps on whilst brushing their teeth. Right, so overall it is based on the average for a postcode. So the technical documentation will talk about the detail of the models that we use overall. So it's about looking up and down a street and looking at the average for a postcode and gaining those insights overall. Thank you for the nice comments as well for people who are already using the data. And yes, you can disaggregate the data as well. So thanks for all those questions.
There's a question as well about the tool, the data being able to be embedded in other tools as well, Candy, and the data is agnostic, so you can do that. Yeah.
Yep, great. Yep, we want you to use this data. The more you use it in platforms or BI tools, whatever it may be, you know, that's great. We're very happy for you to do that. Overall, Jim, they've requested you to post your email. It's also on the slides as well. So fantastic. We're doing some work on MMR. Vaccination uptake, be great to understand the population groups where the uptake is lowest. Yeah, that is an absolutely fantastic use case. Ed, do you want to speak to that?
I was going to say on that one again, we'd be very happy to talk you through. I mean, it's very similar in nature to the approach we've taken with the NHS blood group and some of the other case studies that we showed, lateral flow being a perfect example. So I'm sure, I mean, Jamie, Gary, myself would be very happy to have a conversation with you directly about the approach they took, talk you through the specific steps, and hope give you some guidance that you can start to apply to your own use case. I think that's a fantastic one. I'm sure it would add some really significant value too.
Great.
Definitely.
So last question. Sorry,
as we mentioned at the beginning, we've got all these messages, so we will be reaching out to you after to come and speak to you about these particular challenges that you've got. So if there are any that you haven't put in the chat yet, feel free to still chuck them in now, and we'll be reaching out to you in the next week.
Yeah, brilliant. Yes, data is available at postcode, UPRN, etc. No problem, and can be aggregated as well. So thank you, everybody. Thanks for the interaction on the session and for all your questions. We will go through everything and just check we haven't missed. We will reach out to you. We will make the video available. We will make the presentation available. Jim is your contact at the NHS. Jamie and Gary, your contacts at the CACI. Any questions, please reach out to us. We are more than happy to help, but I hope you found the session about the data that's going to be made available to you, some example case studies, really useful. We are hoping if it's been useful and you start accessing the data, that we will run similar sort of insightful and informative sessions and webinars every 6 months or quarterly, depending on your requirements. So do keep those topics of interest coming, and we can tackle more issues in the future. So thank you everybody for your time. Thanks for joining. James, thanks for being our contact at NHS, and sorry if you're going to get lots of questions.
Brilliant.
All right, thanks everybody. Take care.
Thanks,
Cheers.
everyone.
Bye-bye.
Thank you. Bye.
Bye-bye.